Hello, I'm LaTanya Turner. As you've just seen, changes in family structure over the last 50 years have redefined who is parenting our children. To discuss these changes and help us understand the impact on children's health, we've invited 4 panelists into the studio. They are Dr. Quentin Humberd, a developmental behavioral pediatrician with Blanchfield Army Community Hospital and director of the Child and Family Assistance Center at Fort Campbell. Sheila Jones Calloway, a Juvenile Court Magistrate for Metropolitan Nashville. Robert Taylor, New Life Program Manager with the Metro Nashville Public Health Department, which is encouraging father involvement in Davidson County. And Kate Driskill Kanies, Program Coordinator with the Regional Intervention Program operated under the Tennessee Department of Mental Health and Substance Abuse Services. Thank you all for joining us today.
Thank you.
In the report, we just saw a number of different types of families, and we saw some different variety of people serving in the role of parent. So let's start by talking about whether it matters who's parenting the children when it comes to that child's well-being, that child's health. And Dr. Humberd, it seems like that would be a good place for us to turn to you.
Right, and I think that it's real important to recognize that the military, particularly over the last 10 to 11 years when we've been in a wartime mode, has been almost a laboratory for how we parent and how we develop families, because a deployment, by definition, takes one of the parents, either the mother or the father, out of the family and forces a change that may not have been planned by that particular family. So we've learned, I think, through the experience of trying to develop different programs and plans at Fort Campbell, how to support military families, that a stable family is important, and who parents the family, or the child, actually is very important in terms of improving the outcomes of those kids and reducing the stresses that they experience.
Can you be a little more specific about who? Does it matter which parent? Is gender important?
We don't think that, from what we've learned so far, is quite as important as maybe we once thought, a few generations ago. The idea is that the parent, whoever the gender is a nurturing person and is connected to the child. The child feels like there is some safe and understandable routines. And again, it can be, and as in many situations, it can be supplemented by a grandparent or even an extended family member. Mm-hmm. But the important part of that thing is that at least one parent is connected to that child in a way that they feel safe and loved.
Okay, so not so much who in the traditional definition of that word, but the way, the method that particular individual parents.
That's right.
And the characteristics and activities you just mentioned. I heard you saying a lot, yes. Kate, so tell me what you'd like to add to that.
Well, in our program, the Regional Intervention Program, we invite whole families to come with us, but I'd say that primarily we have single parent that will be in the program, whether it's because the other parent is working and unable to come, or because that family is a single parent family. Many times people are worried because they say, if we don't have the whole family with us, can we really make some change in this child? And the answer is absolutely, because you're really working on that relationship with your child, and to be a nurturing adult, as Quentin was saying before. And that's the important part of it, is that one adult is making a difference in that child's life. And really, we have not found that it matters whether that's the father or the mother.
We're really talking about sort of a change in the social order in some ways. And I guess I wonder, has the rest of society and the general public caught up with what is in reality a change in the social order to some extent?
You know, I think that there have been some changes. I think we have a long way to go. I think one of the influences that we have seen coming in our program over the last many years has been a large and growing population of immigrants, which has really changed the way that we're working with families, in that we have to be more culturally aware and we have to offer services that are also linguistically competent, so that we have interpreters and materials that are accessible to these families. We also realize too that when we have different family structures, that sometimes that period of being in our program is going to be longer than a typical family that may be coming in with less stress in their life.
So sometimes the change in parenting or parental structure is really about new cultures being introduced and new norms. But many times it's about a missing traditional parent. Robert, I know you work with that particular focus. Tell us a little bit about the role of the father and what you're trying to do to support those folks.
Well, fathers are definitely important. And at the Metro Health Department here in Nashville, we try to look at statistics to base all of our programming and activities off of. And we have seen statistically that children who are raised in a two-parent home do better in every area of their life. But also the children who have an active and involved father in their lives do better. And so at the health...
And let me just interrupt you. When you say two-parent, that's not, that part of the research is not so focused on gender. But the next statement you made about the role of father is?
Actually, the studies that I have seen are looking at married couples, male and female. Okay. They're looking at married couple households, male and female, and those children tend to do better. And a lot of it has to do with the stability that's provided by that household. But we also see that even in the newer families that we see, where there may be a blended family or so forth, when a father is engaged and involved, those children do better than the children who do not have a father that is involved in their lives. And so that is why we want to support those men who want to be active and engaged in their children's lives. And we do that by providing them with different resources that help them to have access to their children. And it gives them the knowledge and the skills to be able to spend quality time with those children while they're there.
Okay, and not to be picky, but are you saying a father figure? Is your experience showing that it needs to be the biological father?
When a biological father is available, that is the ideal situation.
Okay. All right. Is there anything you'd like to add to?
I think I'll add on to what Robert was saying. And what we deal with a lot in juvenile court is unmarried parents. And we notice that, our goal is to do the things that we can to support the children. And, the goal of juvenile court is to make the children better and to look at the best interests of the children. And we know that a child that has both parents, whether it's father, mother, or whatever type of relationship it is, but if it has two loving, caring, structured type of atmosphere around them and helping them the children do much better. And there's a less link to delinquency, so we have less juvenile delinquency if the parents are involved in their life from the get-go. And one of the things that we strive to do is to keep, whether it's the biological fathers or whatever the type of parent it is, that we try to keep them connected and into the process of raising their children well.
Okay. And continuing to talk about different configurations of families, many adults are choosing now to become single parents. So, and I'm kind of, moving on and advancing what you're talking about. When people make a conscious choice, I assume an informed, conscious choice, how does that affect all of this? To be a single parent because of whatever, maybe they haven't met the right person or, whatever, career issues, anything like that.
And I tell you, it's a difficult thing for the law, and the law is definitely far behind what the trends of society are. And currently in Tennessee, we're struggling with surrogacy type of issues. We're struggling with parents that are choosing to do, whether it's in vitro or whether it's same-sex marriage. The law has not kept up with what the trends of society have been. And so it's a struggle when it comes to deciding what type of rights, how do you make sure that everybody is is protected and has the rights to the children as they're supposed to. But ultimately our goal is to make sure that the children are healthy and happy. And
even in those cases, there can be another person involved
Absolutely.
to sort of meet that
Right.
configuration that you're saying is ideal, which is to have two adults.
Absolutely.
Correct?
And two adults that are going to really care and take care of and nurture that child.
Okay. And do you see any, with these more modern models of families, do you see a change in how children are presenting to you and maybe the types of health and wellness issues that are coming up?
I think as a pediatrician, I think we really learned that we need to have our science catch up with our culture. I think as Sheila was saying a minute ago, we're not dealing with the Dr. Spock parenting model of the book that I was trained with 30 years ago. Right. What we're really having to decide is that are we going to let kind of knowledge and science define what is going to be our best advice for families, or are we just going to sort of figure it out as we go along? And we're hoping that again, policies and policymakers and other people that are going to help us are going to support the idea that we have to understand before we can start making pronouncements about what is best. I think the comment about the law is a perfectly appropriate example of that sort of thing. In the military situation, we have created single parent families for 1 year at a time, for many of our families 5 or 6 times. This helps support, I think, in an interesting way, the fact that 2 parents at home is better because we know that the emotional symptoms of children goes up significantly while their parent is deployed. But at the same time, we know if you can't control that for either by choice or by circumstance, what are we going to be able to do to help mitigate that particular risk? Is it always bad in that situation? In a lot of our families, I tell a lot of my patients and families, I tell them, when there's a stepfather or another father figure involved, that anybody can be a dad biologically, but what does it take to be a father? Right. I know Robert's probably working on that same concept in his program as well.
So the information and the way you engage parents needs to adapt to those situations. And that can sometimes, I assume, lead to a more positive result just by talking to parents about how to deal with their circumstance. Yeah, exactly. And it may not be, like you said, the Dr. Spock model.
Right.
And you've learned to do that very, very much by necessity in the military setting.
But sometimes, again, also with, we don't want to bring our biases either as a community or as a culture into what is right and what is wrong in that situation. We really, as a doctor, I like to try to say I've based something on evidence. And this is really where one of the needs is, as we've discussed all these issues in these segments, is about what is the evidence that's going to point us in the right direction and not get bogged down. And all the programs here actually are evidence-based. They're in a situation like RIP and programs like that. We want to use the best evidence that we can to do the right thing and not just sort of go with whatever the culture says.
And I have to ask, just continuing that thought, how much of some of the more negative impact related to childhood stress and those sort of things has to do with people trying to adapt what is not really the traditional model to fit the traditional advice and expectations. That seems to me that it would create more stress for parents. Is that right, Kate?
Yeah, I think so. We see that happen sometimes when we have families that are coming in that may be getting advice from either other family members or people just that may be around their community. And sometimes families hold themselves to such a high standard of this is the way it's supposed to be because it was like that 50 years ago, or they see that on TV. It's an impossible goal to try to reach, and we need to help them to be able to make their expectations more realistic for their child and for themselves. And one of the ways that we can do that at RIP is to make sure that parents have other parents around to support them, to support each other. And we'll hear many times that families will come in and say, I thought I was the only one dealing with this. And it's wonderful for them to be able to see other families that are saying, oh no, this is pretty common. We're dealing with this every day too. It makes a huge difference in that person's life to know they're not the only one out there.
Okay. And Robert, I would imagine you have to deal with that a lot with some of the men you work with, maybe them trying to deal with their own esteem issues or what people have labeled them or expect of them? Is that a hurdle you have to address?
Yes, it is a hurdle that we have to address. I think what we're seeing nowadays with so many blended families coming through different programs that we have, you see fathers that have multiple children with multiple mothers. And so they have to navigate that in a way that is going to be different than a father who has all of his children with the same mother. And so how do you discuss dealing with one child's mother who you don't live with and making sure that you can have access to your child to be able to instill the values and the different cultural things that you want to have that child to have. And so I think that as we go forward, as practitioners, we have to learn to adjust our style to be able to meet the needs of the fathers.
And not indict someone because of the circumstances.
Right.
And you know, I want to shift just a little bit because we want to talk about what all this means to the children. And what we saw in the video is that sometimes it shows up in the area of medicine that you specialize in, behavior. Tell us a little bit about behavioral health and how all this affects that, Dr. Humberd.
Well, behavioral health in kids in general is something that in my 30-year career has, I wouldn't say it's exploded, but it's on a constant rise. And it is as a result of multiple factors, not just in my military practice, but in my general practice prior to that. We now know that 1 in 5 children that come into a pediatrician or primary care office has some sort of impairment related to behavioral health. And this is in relation to multiple kind of inputs that cause it, but it certainly is a problem that is not going away, and we've got to be able to figure out how we're going to address it better.
Can we just back up a little bit and define it? Because most people think behavior, acting up. You know, that's not really what you're talking about.
No.
What is behavioral?
Now, again, and of course it depends on the child's age, but basically we talk about, you know, target behaviors that cause a child not to be successful at home with peers of the same age in their classroom. It's like they can't play normally with other children in the younger sort of ages. We want the job of the child is to play and be successful and grow and develop and become competent as a young child. Behavioral problems interfere with that, and they take various labels, but in reality they are basically symptoms, target symptoms that cause a child's development to be either altered or stop. And a couple of examples would be, one of the more common things would be anxiety. And worries. And what isn't on the media now that children are exposed to 24/7 that wouldn't raise their level of anxiety, sometimes at an age at which they're not emotionally able to handle it. Another one would be, not paying attention or having impulse control problems. Those two factors are also some of the most common things that we see. And again, we try to stay away from labels that we tend to use more in adults and try to describe the problems that children are having and where they came from so that we can figure it out. And you know, the basic principles of where those come from is based in parenting. And Robert made me think about the fact that parenting or the lack of parenting is generational a lot of times. And a lot of the people that we're trying to help didn't themselves get parented. At Blanchfield, we're dealing with a population of soldiers, the 101st, the tip of the spear we call them, 18 to 30-year-olds typically, and many times we're parenting them as adults so that they can become better parents. They want to learn that, but a lot of times it's a lack of that own skill. And that begins, again, in these younger children, and these behavioral symptoms, mild, moderate, or severe, will occur at that youngest age. And if we don't intervene, it doesn't have as good an outcome as we would like.
And are we talking about precursors to what we might refer to as mental health issues in adults? But at this level, yes, it's defined more by the behavior.
Right, right. And I think we've done families a disservice in trying to talk about the 2-year-old with bipolar disorder, for example, or the 18-month-old that has ADHD. I think we need to talk about the fact that when children's, or just the fact that children have bad behavior, that their children are being bad. We think of bad, I try to explain to parents that bad is lack of a skill. That most young children particularly don't go to bed at night thinking how I'm going to mess up tomorrow, how I'm not going to follow the rules, right? Or break a law or things like that. Now, maybe as children get older, that's a problem, but it's a learned thing. Early on, we want children to feel successful, and if they come to that crossroad and they don't know what to do, that's when we see the behavior. We label the behavior, but we're really looking at the lack of a skill that they didn't have to do that. That skill is learnable and teachable if we use the right models with these families and give them the right tools.
And so tell me if this is too much of a stretch, but if you have a non-traditional family configuration, then, but folks are trying to impose traditional advice and interactions, then that's where the child can kind of not know where to go, as you said, or not know what to do, which can lead to some of these behavioral
I think so, and I think partly it's because, again, if let's say it's a single parent has this issue that they feel like they can't be effective unless the father is there or unless the mother is there. Right. That puts a constraint on them so that they realize that there's another way to provide that same amount of guidance, stability, and nurturing that we need. So those are the constant principles that go along with good parenting, whether it's a traditional family or not. The processes by which you apply those principles are going to change. They already are changing in our culture. But the principles that guide success are going to stay the same across those systems, and that's what we're trying to get people to understand. It doesn't necessarily have to look the same when you've got multiple mothers, but the way you approach that individual child in that relationship as a father should be the same with all those children. Right.
But Sheila, I have to ask, how do you deal with that in juvenile court? Because you are sort of locked into what the law says, and the law may not allow for some of this flexibility.
Absolutely, we do have to follow the law first and foremost. That is what we're charged with. But within that, we are able to bring resources and just look within the community to what we can do to help a parent out or to help a child to change the ways that they need to go. And you know what Dr. Humberd and what Robert said, that it's all about teaching them how to parent is one of the things that we definitely believe in juvenile court. And that's why we partner with programs like the New Life program, because we believe strongly that if we can teach these parents how to do a better job at parenting, then we'll miss that whole level of juvenile delinquents, you know, that don't get it and don't figure it out from early on. So the parents have to be active, involved in their child's life from day one. And it requires, and sometimes it is a choice, that it's just one parent. But the more people that are involved in a child's life, the more structure that a child has, the more people that a child can depend on that are going to be there for them, the less likely that that child will have problems in the future. And that's what we have to stress. And whether it's we have to do a removal from a biological parent and place a child with a grandparent, or chase a child.
That's what I was going to ask you. Talk about some of the tools you might have to help with that.
You know, we look to foster care sometimes with the Department of Children's Services. We hope that we can have relatives that come up and will step in and take the place if a parent's not able to parent the child for whatever reason. We like to be able to give the relative that steps in some tools to help them, because it's difficult when you're not expecting to raise a child. You've already raised your children, and here you got your grandchildren that you're raising now. You didn't save up for that. You didn't set aside additional school clothes and things for that. And so we like to be able to at least give you some resources and some places where you can go in order to help you to be successful. Because really the child needs, if they can't have their biological parents active in their life, they have to have someone who they can count on at all times, through the good times and bad. I think about my childhood and the bad times that I may have made my parents suffer through. But regardless of how bad I was or how the behaviors I didn't quite get quite right, I knew I had two loving parents that were going to take care of it, and that were going to always love me and take care of me, and that helps. And so that's what we try and give every child that comes to the court system, that same support system.
Okay. I want to talk about moving to other partners and agencies in the community that might interact with parents. because really in some cases we're talking about circumstances that lead to these different sometimes it's choice, we've addressed that, but sometimes it's just circumstances that people can't control or they don't know how to control. So what sorts of things are needed in the community to help these families, besides it sounds like a change in perception, to help these families navigate the changes in who's parenting children and better support them?
Well, in our program, when we were talking about stressors, you know, for younger parents or grandparents or great-grandparents who are raising their children, there is a bigger need, you know, for outside help. Sometimes we have families that are without a stable home, I mean, a place to live, or they don't know if they're going to have food, you know, for that evening. And so what we try to do is to hook them into systems, whether it's finding a caseworker in through the state that can help them to access some of those services, maybe some kind of public assistance or counseling if we have issues that the parent's dealing with that are affecting their ability to be able to even learn these new parenting skills, that they may have substance abuse issues. We can try to help them hook up with treatment programs for that. So I think that one of the things that we have learned is that we can't do everything, and that it is a community effort, and also that intervention has to start really early. The earlier the better, and I'm talking about like 2 years old or younger. We know that the older the child gets, they're going to have a lot more problems in school, and schools will even say, and they are, by the way, one of the main partners that we work with, child care providers and schools. We know that if children are presenting with social skills that are problematic and don't know how to get along in a group, they're going to have a much tougher time in school and in life in general. So we need to identify those children early and work with everyone that's in their environment, and to rally those other services for them.
And speaking of that, Robert, I want to let you respond, because I know you have a lot of experience trying to bring different services and agencies together, and I'm sure that's sometimes a challenge, and it may be a challenge for the population you work with to get that support, especially because people have preconceived ideas. How do you do that?
Yes, it's been a challenge, but I think that once you can help someone empathize with the plight of these families and help them to understand that our focus is on the children. And regardless of who their parents are or what the traditional or non-traditional family that they're being raised in, we are wanting to focus solely on that child. And
so they need to move past the idea of deadbeat dads and absentee parents, and think about the child. It's not about the parent.
Right. Sometimes dad isn't deadbeat. He's just dead broke. And he can't afford to take care of the children that he has, and that's due to a lot of the other circumstances that have come up in his life, with him maybe not having a father, with him getting involved in some criminal activity that may be on his record and prevents him from gaining employment. So there's a lot of issues that come up, and so there's a lot of agencies that touch these families' lives. And I think as a whole, our community understands that we want the best outcome for the children, especially the children here in Nashville. And we have to come together to find out what we can do to address a lot of the barriers that the families face in having the best outcomes for the children.
And it sounds like part of the equation is to empower some of these parents to accept how they're parenting, or the circumstances at least of their parenting, and figure out how to make the best of it, including the fathers that you work with. I'm sure that's a big part of building their esteem and helping to empower them.
Yes, and focusing on decision making. So a lot of this is about making better choices. And it's okay if you make one bad choice, two bad choices, but when it starts affecting your children and the outcomes of your child, then we have to talk about how we're going to change your decisions so that your child can have the best possible opportunity to be the person who they were created to be. So.
All right. Can I add something to that, too?
Real quick.
I think that, you know, we're talking a lot about families, but in our program, we believe that those changes have to be made in the family structure. The families themselves are critical. That means that the programs that we provide have to be driven by families. They've got to be a key player in that child's life, but also in the treatment team and what we work with them. It's not just looking at that child, but we've got to change their environment, to be able to make those changes durable over time.
All right. Yeah. Well, it's important work that all of you are doing for this topic, and I have a lot more insight about it, and I'm sure our viewers do too. Thank you very much for joining us today. And you can learn more about the children's health crisis in Tennessee by going to wnpt.org/children's health. Stay tuned to NPT for continued coverage of this issue. And we want to hear what you think. Write to us at tv8@wnpt.org or call our viewer comment line 259-9326. Thank you for watching.
Major funding for NPT Reports Children's Health Crisis has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the HCA Foundation on behalf of TriStar Health, and by the Metro Public Health Department through a grant from the U.S. Department of Health and Human Services. Additional support provided by the Baptist Healing Trust and by members of NPT. Thank you.